Diabetes, a familiar disease to many, especially in the German-speaking realm. Diabetes is widespread, and in the last few years, the number of diabetics has significantly increased. This has various causes, and recognizing these causes can help prevent the disease or improve its course. When we talk about diabetes, it is important to know that there are two forms of the disease, diabetes type 1 and type 2. Type 1 diabetes is an autoimmune disease in which the body attacks and destroys the cells of the pancreas. The pancreas is responsible for producing insulin, which allows cells to absorb glucose, sugar, from the blood and turn it into energy. If no insulin is available, the glucose remains in the blood and the blood sugar level is thus increased. Type 2 diabetes, on the other hand, is caused by insulin resistance, which is a metabolic condition. While the pancreas produces normal amounts of insulin, cells do not respond to insulin as well until they ultimately become resistant. Type 2 diabetes used to be considered a disease of old age, but today, more and more younger people suffer from the disease. This is due to increasingly unhealthy lifestyles. Lack of exercise, obesity, and poor diet increase the risk of developing type 2 diabetes. Although this is bad news, it also means that a change in lifestyle may help reverse insulin resistance or improve the course of the disease. Type 1 diabetes cannot be cured, and those who suffer from the disease must inject insulin directly. However, with a good diet, exercise, and other medications, those suffering from type 2 diabetes can successfully manage the disease and avoid insulin injection. High blood sugar levels can cause severe damage to the body, including damage to nerves and blood vessels, which in turn leads to problems such as diabetic foot syndrome, amputations, or vision problems. Diabetics also often suffer from kidney problems that may require dialysis. These are just a few examples of what may happen, but as you can see, the consequences of the disease are severe and should be taken seriously. Since there is hope for improvement with type 2 diabetes and the number of people developing the disease continues to increase, we should explore this topic some more. So what can you do if you have already been diagnosed with diabetes or are genetically predisposed to developing the disease? In any case, you should completely turn your life upside down. This means more exercise, a healthy diet, adequate consumption of water, and losing weight. With these changes, many are successful in improving the course of the disease or in reducing the number of medications they need to take. Here we show you another option that has already helped many, the chaga mushroom. Chaga is a mushroom that grows on birch trees, especially in regions with cooler climates. In dried form, it can be made into a tea. The mushroom has 3 properties that can have a positive effect on our body. Chaga is anti-inflammatory, immune-boosting, and metabolism-stimulating. These 3 properties are exactly what is necessary to fight diabetes. Here are the reasons you should drink chaga tea. The chaga mushroom stimulates metabolism and thus helps the pancreas produce more insulin. At the same time, it makes cells receptive again to the hormone. The body can now start to re-establish balance and to lower blood sugar levels. Chaga thus directly targets the cause of type 2 diabetes, insulin resistance. The chaga mushroom's anti-inflammatory and immune-boosting properties protect organs and cells so that they do not suffer any further damage. And this does not only apply to the pancreas, but all organs. The antioxidative properties thus positively influence the body. Other conditions such as elevated cholesterol level are often associated with diabetes. LDL cholesterol in turn may lead to further vascular damage and heart problems. The chaga mushroom helps lower your blood cholesterol and triglyceride levels and break this vicious cycle. Chaga tea has a decisive advantage in use for treatment. It helps balance blood sugar levels but does not lead to hypoglycemia, blood sugar levels that are too low, which may be dangerous to the patient. Therapy can thus begin without negative side effects. You should drink 2 cups of the tea per day. It is important that the first cup is consumed after getting up on an empty stomach, approximately 30 minutes before the next meal. The chaga mushroom is dried and processed into a powder. If you have raw chaga mushroom, you need to dry it for at least 1 month before you can grind and process it. Given the effectiveness of the chaga mushroom, does it still not help with type 1 diabetes? Because type 1 diabetes is an autoimmune disease and cannot be cured, the chaga mushroom does not have the same healing effects, but it has the same positive health effects. Protecting the other organs and cells and improving blood lipid levels can help reduce progression of the disease. The chaga mushroom may also help in balancing blood glucose levels and prevent an additional insulin resistance. Type 1 diabetes cannot be cured, but it is possible that less insulin may be required. Diabetes is a disease that may have severe consequences, but it can be well managed if you adhere to the guidelines. Even if you are drinking chaga tea, it is important that you adopt a healthy lifestyle and diet. The chaga mushroom has already helped many diabetics and brought about true miracles. Many people have been able to live a completely normal life with the help of this natural wonder. Why not you, too?